Yes.
We're calling you from Boston. You're hearing us here, the NICHQ offices from Boston. And it's my pleasure to welcome you all today in a really exciting call. And a huge thank you to our partners at 0 to 3, as well as our newly formed partners at Brookes Publishing for supporting our impact grantees and their respective place-based communities in understanding better how to use the ASQ with diverse populations. That would be the Ages and Stages questionnaire. I apologize for speaking in acronyms. So I don't have much to say other than to say thank you, because it's really important that you're here to support our different teams and the profession at large to be able to know what it will take to transform the systems that support our children 0 to 3. So really it is my absolute pleasure to turn this over to one of the people that has been leading and putting this work together. So Debbie, thank you so much, and I'm going to turn it over to you to lead us through today's call.
Thank you, Zee. Hello, everyone. We're really excited this afternoon in this morning for those on the West Coast, to have presenters today from Brookes Publishing, and as well as Utah ECCS team members to provide some information on use of the ASQ, Ages and Stages questionnaire, on engaging families from diverse backgrounds and developmental screening, as well as child well-being. So our agenda for today, we will have an overview of the topic by the ASQ authors, as well as a state perspective from the Utah ECCS team members on lessons learned from bringing developmental screening and child well-being to diverse populations. So it's my pleasure to introduce our presenters for today. And just a reminder, I want to make sure that everyone is aware that you can use the chat box throughout the entire call to share your questions and thoughts, and we encourage you to chat among yourself as you hear the presentation today. So from Brookes Publishing, we have Jane Farrell. And Jane is one of the ASQ authors, as well as an early intervention and early childhood special education specialist with Early Childhood Care in Oregon. Jane has a wealth of experience and knowledge. She has had various roles as a home visitor, a parent-toddler group teacher, a preschool teacher, and IFSP coordinator. And she has had a use of the ASQ and provided training and consultation on the use of the ASQ in over 25 states. And she also served as an early intervention specialist in Germany, where she provided training on the ASQ for military communities living overseas. And we also have Liz Twombly, who is a senior researcher and instructor at the Early Intervention Program in the University of Oregon. She has over 20 years experience and has been involved in ASQ research, including renorming the ASQ social emotional scale and the ASQ-3. And she has conducted trainings on both of those tools nationally and internationally, and has provided technical assistance to states on the development of early identification and referral systems for young children. She's also had experience working with young children living in transition and the development of systems of care for substance abuse newborns. She is currently working on a team to develop a universal system of screening and referral for families in the state of Oregon. And from the Utah ECCS team, we have Darcie Chamberlin, and she is a registered nurse for the Utah Navajo Health System. She has both an associate degree in nursing and a Bachelor of Science from Utah State University. And while she was working as a nurse in the Blue Mountain Health System, she became very interested in prenatal and postnatal and pediatric care. And she joined Universal Newborn Hearing Screening as a clinical nurse, and was later recruited to be a part of the public health system to work as a home visitor with young Native American families. And Darcie is a mother of 5 and is very passionate about increasing parental awareness of proper growth and development. and is excited to present some of the successes and challenges facing the diverse populations in San Juan County in Utah. And we also have Rebecca Virgo. She is the Program Administrator for Prevent Child Abuse Utah Home Visiting Program, Parents as Teachers, where she is focused on empowering families with young children under the age of 5. She currently serves as the co-chair for the Ogden United Promise Neighborhood Prenatal to 3 Committee. She is a mother of 6 and is a first-generation college graduate, a bachelor's degree in English and geography. And she's a poet and an advocate for overall health and well-being of families and communities. And she is dedicated to finding joy and healing trauma through truth. And then lastly, from the Utah team, we have Justin Nuckles, who is the project coordinator for the State of Utah's Developmental Screening Initiative, utilizing the ASP screening tool. And his work, he has been working for the state since 2015. He has a bachelor's degree from a university in Utah and has a master's in child development from the Erickson Institute in Chicago, where he was a 2012-2013 fellow with the UMass Boston NAPA Infant Parent Mental Health Program. He has 3 children and is a self-proclaimed geek and loves reading, sharing, and discussing anything related to early childhood mental health and brain development. So I am going to turn it over now to Jane and Liz to provide an overview of use of the ASQ with engaging diverse families in screening and child well-being.
Hi, it's nice to be able to talk to all of you today, this morning. We're really happy to bring some information your way. My name's Liz Twombly, and both Jane and I have trained a lot and worked a lot around the country and you know, just learned a lot through meeting, engaging with folks who are trying to use these tools out in their communities. So we hope to bring you a little bit of the wisdom that we've learned from the folks that we've worked with over a number of years here. That's us. I'm on the right. And Jane, you want to say hi?
Hi, I'm on the left.
Okay, so today we're going to talk for about 30 minutes. We're going to talk a little bit about working with the community. I know you guys are in the first and second years of your grant, so assume that you've done some of this work that's more global and on a broader perspective than very specific strategies related to the ASQ and ASQSE, but just give you a little bit of information about that. Then we're really going to talk about the ASQ and how these tools how the design of these tools can really help support diversity in families that you're serving. Talk about staff needs and support around screening and engaging families, and then we'll finish up with just what are some of those strategies related to engaging diverse families and maybe next steps as you're moving forward. We don't have much time, so it will go pretty quickly, but hopefully we may have opportunities in the future to also follow up with questions you may have. Okay. So just to get on the same page here, I know, all of you know what family engagement is from the perspectives of your program, and just to say, when we're talking about family engagement in screening, what we're really talking about there is developing a process within your systems and your communities where, each family member really takes the lead in this whole process, from the initial gathering of that information about their child, as well as, all of the next steps. What are we going to do? What's appropriate to do with this information? What are appropriate next steps? So family engagement really refers to that entire process. So some keys to success in terms of engaging families really include that you really understand, you really know these families and respect who they are and what their values are. around parenting and their children and their hopes and dreams, that you really develop systems of training and support and coaching that really work closely with your providers that are really about relationship developing during the screening process. So we're going to talk more about that later, but just how, the language that we use, how are folks going out and talking about screening and listening to families and what they think. So really developing a relationship. So, how do you develop a system of both training and then ongoing coaching that supports that? And then, again, this careful use of language, just slowing the process down. We all have, things that need to happen, boxes that need to be checked in, and frequently we hear this, that you end up with this stack of paperwork. How do you pull out screening, either the developmental screening tool or the social emotional screening tool, and slow down and go, okay, now here we're talking about your child. This is the meat of what we're trying to do here is with these tools is really talk and learn and think about how we can support your child. So anyway, that is important across the board for all families. And, this talks about families who've experienced stress and trauma, but really the careful use of language and slowing the process down is really important to engage any family, but with special consideration to those who may have experienced negative experiences with systems, programs, and or have experienced stress or trauma. So, okay. And then, again, just around definitions in terms of what we're talking about when we're looking at diversity and culture. And I'm just going to start with the third bullet there, where what we're really talking about with this is that we're talking about many different types of family characteristics when we're talking about diversity, including things like who's in the family, how big is that family, how many members are there, what are the ages, education, do any of the family members have a disability, who's in the family, as well as things like socioeconomic status. Is the family living in poverty? What do they have on hand in their home to facilitate screening types of things? Where are they located geographically? I see we have someone on from Alaska, and the huge, size of that state, and that families are, just all throughout in small villages. So what kind of challenges does that present in terms of conducting screening? And then special factors, homelessness, military families, refugee families, and then, of course, cultural diversity as well. And when we're talking about that, we're really talking about what language, the race of the family, their ethnicity, and sort of geopolitics that the family comes from. When we're talking about all these different diverse characteristics of family, culture is probably the most important, and it's the most likely not to change, to stay kind of static over time. And it really shapes, a family's foundational beliefs, which in turn really impacts how they perceive, interpret, and behave within their family and within preschools and schools and the community that they are part of. So that's sort of just a foundation for, what we're talking about when we're talking about engaging families from diverse backgrounds. Okay, so then this is, again, very global information here, but in terms of working with the community, many of you may have done a number of these things already, but if you haven't, or if you're struggling in terms of providing services to a specific cultural group or within the context of your community, these are some things to keep in mind that you maybe come back to or do, at the same time that you're building other screening aspects of your program. So one is just to recognize and respect family expectations, considerations, barriers to screening, and the knowledge, the indigenous knowledge that comes from the community. So, you know, as you're working within the community, just to basically continue to learn about the culture, engage the community, and explore what kind of barriers there may be to family engagement. And that's going to be different, you know, across the board depending on your communities. For example, there may be communities where you really want to set up systems to screen that respect oral communication that may be highly valued within a community versus everything being written down for families. We may not recognize a community's barrier to screening without really stopping and spending time to listen. And I know, you know, this comes, we've had examples of this throughout over the years, you know, where we're like, yeah, screening, you know, it's a wonderful thing, you know, we're bringing it in, it's all positive. And I remember being in a training in New York City where we had a very large training. It was a group of paraprofessional home visitors that were going to be visiting you know, families in low-income housing in New York City. And somebody wrote in the training evaluation that doing this kind of thing could really destroy a kid. And that really made me think about, wow, you know, like, where is that coming from? And I just hadn't thought that way before. And, you know, I think in reflection and talking to some of the people that had, you know, brought together this training, they're like, you know, just experiences with education systems may be very, very negative. So, you know, without understanding that people are coming, or a whole community may be coming with an extremely negative feeling about what, you know, these education systems might do, or, you know, how they might influence a family, without knowing that that may be a negative experience, we can't really move through that barrier. But if we know it, we can say something like, you know, really ideally what we're doing here is trying to keep kids out of those kind of systems. We're doing early intervention, which is so reframing how we talk about screening and what we're trying to do with screening. Anyway, so we also need to try to connect the values that a community brings and consider adding, you know, culturally valued indicators to the information gathered during that process. And so, for example, if you know a community really values curiosity or independence in their young kids, how can you talk about screening and really emphasize those values? And some programs have even added an extra page to a questionnaire to include some more items that may really reflect things that that culture really values. You can work on conducting focus groups to ask these kind of questions of families. Be sure community members really get a chance to articulate what is child development? You know, do they think about child development in the same way we do, or do they have a very different vision of it, or do they really not think about it at all? You know, it's a whole new concept for them. Try to really get some champions of screening and community ambassadors to connect with families. So if you have your folks out there who are within a community but also are real champions for what screening can do that's real positive for children, to bring them in. You can go together through the ASQ and really look at questions. Think about if there's any jargon, adapt examples. We're going to talk about this more later on in the presentation, but that's an important thing to do, is really examine the ASQ questions together and see if there are items that need to be modified or omitted while you're moving forward. And then you can also create, you know, people have talked about this, creating an ASQ community of practice, and there is a resource that you will be linked to at the end of this training that can really that can kind of guide you through what's meant by that. But anyway, bringing your community groups together and really partnering with them around screening is important. Supporting home language is really critical. It's important to children developing social, emotional, cognitive, and language skills. So as much as possible, just making sure that you're working within the family, within the context of what their home language is. To prepare for those language needs, is there a translation or adaptation of the ASQ or the ASQSE available? we really talk about especially good adaptations, because a good adaptation is really going to look at materials or activities that make sense for that community. Are there other materials that are available in the home language, for follow-up after screening or that can support a child's development? Are you going to need an interpreter or a cultural broker? And we're going to talk again more about sort of using interpreters, what we mean by cultural broker, as well as some of the language that are currently available in the ASQ system. Okay. And then finally, just building acceptance about this whole process. And I met one of your colleagues last week at a training, a very nice young woman from Western Massachusetts who may be on this call, but I really enjoyed talking to her. She used some really beautiful language, I think, around working together with families. One thing she talked about was being a humble provider, and I think that term right there says a lot about how we can build acceptance, build relationships, and really partner with families to build acceptance around this process of screening. In terms of overcoming logistical and philosophical barriers, we really need to understand a community's unique worldview of parenting and child rearing, and we need to really think about logistical factors that are going to impact our screening. So where do families live? What kind of access do they have to resources and technology? We really need to build trust and relationships before going straight to screening. Another thing that I learned from this young woman last week, she talked about when you first go into meeting with a family, she, in her head, how she frames it is, what can I learn from you as opposed to what can I tell you? And I really loved that as well. It just really frames up how to start that conversation with families. We want to focus on the universality of screening, just about development and healthy development. What do we mean by that? We want to present screening as a service and not a test, and we're going to talk about that more too. But a good screening done really well really is a service that can do an awful lot of good for families and children through that relationship that you've developed, and the trust that you've developed can do an enormous amount for a family, even in communities where there are not a lot of super high-end services that may be provided. To reinforce the validity of, what I need to learn from you, what you know about your child, communicate the value, of getting this information from families, and really highlight the benefits of screening, including how screening in and of itself, a screening done well, can really have an impact on children's outcomes. So, okay, here we go. I'm already talking too much. We're going to move on to Jane here, and we're going to talk about how the design of the ASQ really supports culturally diverse youth and families.
The ASQ was originally designed as a family-centered tool. It was designed especially as a parent-completed instrument. It puts the family right at the heart of the process. It allows the family to contribute the developmental information that's shared. It gathers all the knowledge, identifies parents' concerns. It allows not only one caregiver, but many caregivers in a child's life to complete a questionnaire. We also know, because it's a monitoring system, meaning that we can screen children in intervals, that it gives us a lot of time that allows a family to actually gain familiarity. The first time a family does this, a caregiver does this, there may be some awkwardness, there may be confusion, there may be a lack of buy-in. But if we persist and continue to offer screenings, intervals every few months, every 6 months, whatever your periodicity, you're going to increase that familiarity, and so the practice, and so often the excitement about doing it. We had heard, I'm just going to share a quick story. In Minnesota, they have a very large follow-along program. They were mailing 33,000 questionnaires out a year to families all over the rural Minnesota, and then they looked at their return rates and they realized, oh, we're not hearing back from X, Y, and Z family, and so they dropped them from the program. And they heard later, where are my questionnaires? The administrators assumed that the families were not completing them because they had not had a return, and came to find out the families very much were filling them out and looking forward to them. And so it reminded them that even though they weren't hearing back, that these questionnaires really were very valuable to families over time. We also have a tool here, the ASQ, that really does reflect diverse populations. Our normative samples reflect the United States Census. Many of our additions are we have these new additions in order to keep up with that census, as well as making any changes that the field informs us of. And we've piloted them and implemented them with many at-risk populations, including populations all across the world. It's really quite remarkable how broadly this tool is being adapted for use around the world. I'd also like to add one other thing that we have now, because there's so much of a broad use, is actually roadmaps are being developed, stepping stones or roadmaps for adaptation, for translation. So I think the ASQ authors have learned a lot. Brookes has learned a lot from folks in the field. So those of you who are ready to adapt, I think that there's better roadmaps now in terms of how to do that most accurately. We also know that the ASQ features, the very features of the ASQ, support success with our diverse families. We are flexible, and flexible. We have flexible completion methods. You can mail them out, do them online, you can do interview, you can do on-site, face-to-face home visiting. What we like to remind folks out there is it's not a templated administrative method. If we take an entire population, even within a small community, and say everyone needs a home visit, or everyone needs a mailer, or everyone can do this online, we are going to not engage a good portion of our families. So it's going to require us to figure out who needs what and in what method. We have flexible use across settings. We can do these in educational settings, childcare, doctor's offices, clinics, and of course in the home. We have very familiar relevant materials and activities, or we have activities and materials that are very relevant. I think we can certainly adapt those and use many more curriculums out there at our fingertips, but we have provided you with things that you can follow up with. We can adapt questions and we can reframe questions. So reframing, I think, is a very important exercise to do with your staff. How do we take a question that might be confusing and look at the intent of that question and then rephrase it or reframe it so that the family can then understand what it is we're getting at. We can omit items if an item, is not relevant for that family's cultural parenting practices. We can omit it, and then we have a way to score the questionnaire that does not penalize the child for not having completed that question. And then, of course, we have many intervals that families can do this over and over and celebrate a child's developmental progress between birth and 5 years of age. We do need to support our staff, and this is probably what we believe is the most essential thing in an effective family engagement screening program. We, in terms of our staff, I want to say before we review the bullets, is we need to really review our staff. Does our staff reflect our populations? And this is a challenge for all staff in the United States, but we're going to be most effective if we can have folks on staff that reflect. We have to be aware of all the different worldviews around parenting, their belief systems about their children. Families and cultures parent differently, and we know where those differences lie, particularly. We know adaptive areas, et cetera. Communication are going to be really impacted by a diverse parenting and cultural differences. We need to be trauma informed. We need to avoid re-traumatization. I think a lot of people are going through now. I know I've been through trauma informed care. This is a popular training that a lot of providers are taking. Liz mentioned earlier, I think we cannot overlook the traumatization people have had from the educational system. We have traumas about special education. You ask anybody on the street, they're going to have probably very negative views of special ed when they think back on their public school experiences. And that's what families are holding when we mention the word delays or disabilities or special ed. So we have to be very sensitive and present this in very positive ways. We have to be very aware of immigration and system experiences. The educational system has been very punishing for many groups in our nation. And immigration, of course, is a very traumatizing event that's happening as we speak. And we need to approach this with great sensitivity. And then also being aware of all those unique expectations of early development, which I think we've mentioned. So let's build competence as staff. Let's have stand-up ASQ talking points in our staff meetings. Let's have diverse staff and make that a goal for our programs. Let us plan a variety of developmental efforts. We might have practice sessions. We might have mini in-services. We might have troubleshooting sessions. We might have brainstorming sessions. So ASQ topics cannot begin and end with a one-day training or a 3-hour training. We need to build in ways to continually support our staff. And we all know what staff turnovers look like. So it's critical that we develop efficient coaching strategies. We want to strengthen our staff's capacity to communicate. How do we interview? How do we ask open-ended questions? How do we be, as Terry Cross cited, courageously curious? And we will discuss interpreters and cultural brokers here in the next slide. So those are also very key. I want to refer to the graphic on the slideshow here. We have remarkably helpful PDFs on the ASQ Ages and Stages website. This is one in particular that just guides you through the use of interpreters. And again, this has all been developed over time from many, many programs in the nation that have been working with interpreters. We do know that interpreters need to be paid, they need to be trained, we need to know how to work with them. We can't just pull a family member in and give them the job as an interpreter. We want the interpreter to understand the ASQ. We want to review that particular ASQ that we're going to be working with the family. We need to be prepared for items that might be unclear. An interpreter may tell us that before we ever meet the family or sit with the family. We need to be prepared for substitutions, for reframing questions that we might predict could be difficult, and then be able to do it in the moment when we have not prepared ourselves and have surprise questions that come up. So all in all, interpreters are very trained, paid people that can be a bridge for us between a culture and a system. Cultural brokers work the same way, so we like to remind us that we don't need interpreters and cultural brokers. Oftentimes they are the same individual. It might be a different way to describe the role an interpreter takes would be a cultural broker, and again, they're that bridge, they're the mediator, and they are not only members of that community that we're working with, but they're also folks that understand what screening is and what our goals and intent are as a screening program and our screening goals. So as over time, I like to remind programs that I like this term, growing your own. Oftentimes, in order to find cultural brokers that can be very efficient bridges, we need to find folks in the community, and they may not have the degrees or the education that, but we can grow folks. We can support them and give them practice and utilize their knowledge as we share our knowledge, and over time really grow those people that are going to be critical to our effectiveness in a community.
Okay, so focusing on diversity and so this next section is really about the process and things to keep in mind. And again, things to keep in mind in terms of your training and coaching with your providers, and as well as as you're building systems to really examine program practices for all these different processes. And the first one is just introducing. You know, how is your program, what is the system for encouraging family engagement? We have a lot of child care initiatives now that kind of have, it's a wonderful initiative, some of these initiatives that are going around. However, they're taking the families really out of the process. They're having child care providers complete it and only getting back to families when there's concern. So like somehow they're using this tool, but in a very different way that's really not encouraging family engagement. So, you know, to look at your practices and see how family-friendly and engaging they are. And then, again, around the staff, make sure they're prepared to be very careful with language, I think. So we have, again, more resources that are available through agesandstages.com around introducing, you know, really, what are the steps in introducing the ASQSE to families. This is also available not only on the website, but in the user's guide, but the website has pulled out a lot of these, the agesandstages.com website has pulled out a lot of very nice parts of the user's guide that really help engage families and help with staff training and whatnot, as well as introductory letters. So to really take a look through those things that are there and figure out what your script or how you're going to train and coach your providers to really engage families during the introduction. If families, you know, I think this is important to have this kind of within your processes to make sure that families can opt out. If families don't value, trust, or feel they have time for this process, you know, we're not going to force them to do so. How do you continue, you know, get back in there, continue to build relationships, come in and offer screening again at a later time once they trust more. There's a lot of reasons why they may not want to do it, and some may be really important. You know, they're already receiving services, or they have recently completed another tool with their doctor, or they just don't trust yet. So to have an opt-out and a way for parents to, again, this process is in their hands. During the actual administration, I like to kind of look at, you know, a pyramid model in terms of how much support families may need. So if we look at, everyone needs the questionnaire, they need that introduction and initial engagement, everyone needs someone to answer questions and discuss results to help with linking. Some parents may need additional reading support, interpretation, access to materials, access to a computer, you know, just some of those logistical things. And a few may need, you know, just much more face-to-face kind of, you know, adaptation throughout the entire process, demonstration, reframing of items, you know, to really understand what's going on here. And be ready to omit, adapt, or reframe questions throughout. But assess the needs of each family member and community to go, you know, how do we tailor supports? As we're interpreting results, we really should be paying close attention to parent concerns, because the parent concerns are considered extremely valid in terms of later on concerns for a child's development. But also by really paying close attention to parents' concerns, you really are being culturally appropriate, I guess, because the parents' concerns are within the context of their home, language, their parenting practices, their community, that they are gauging their child's development related to other kids within their community. So it's extremely important to pay attention to their concerns. And again, so these may be acceptable given their cultural context or parenting behaviors. Whatever they're seeing, they may not have a concern about it, and that's important to consider. Be very careful about interpreting results, especially if you're using an adaptation, especially in domains such as communication, personal, social, which really gets at self-help skills, where parenting practices really come into play. The cutoffs are based in our adaptations. Most of our adaptations are U.S. norms. So you just have to be very careful in interpreting results and consider the family's cultural background when interpreting those results. And then we also have resources on agesandstages.com that are really around discussing results, because again, this may be a make or break time for families as to whether they're willing to go on and take any next steps or support or accept any support for their families. And these are just a few examples here. Remember to start out celebrating the child and, you know, review those questions and concerns when they do come up. Consider where the family is in the process. Are they relieved, you know, that have they had this concern, or are they ready for this information? So again, to use resources and coach providers around discussing results. When you're making follow-up, follow the family's lead, determine you know, what's appropriate together. Don't assume the kinds of activities that we just, you know, assume are, you know, meaningful to families really are. We could always offer, but we don't know whether or not those really make sense to a family. And support families when they're ready, and if they're not ready, rescreening is always a good option, gives the family a little time. Okay, so I think we've talked about this. Cultural brokers may be able to share experiences with systems. So again, going back to that cultural broker model, if you have a member of the community who has actually had a positive experience with early intervention or these types of services and can share that with a family, that's very powerful. So that's a great time to bring those folks in. Okay, and you know, to keep in mind and let your staff keep in mind why families may be hesitant. It's not because they don't love their children. You know, people get frustrated because they want so much for the kids, and providers can get very frustrated with families for not jumping on a referral. But to remind them, you know, about, you know, how confusing and scary, and you know, how they may not have this trust that this is going to be a good thing. So there's a lot of really valid reasons why families are hesitant. Okay, and then moving forward, the last couple slides we have here, I'm going to pass over to Jane. So I think the most important point here we'd like to emphasize is that an effective screening program, you know, is a work in process, right? It's an iterative process. So we want to constantly be evaluating the processes using this family engagement lens. We're not going to get it right straight up, and everyone in our audience is certainly in that process. We understand that it's exciting, your interagency collaborations and these sort of more forward march toward effective screening programs. So we want to ask, you know, key questions. You know, what we want to check in about our ASQ administration methods. Are they working to reach our diverse families, or do we need to make some changes? Do they reflect our communities, our family? You know, have we developed, for example, a local advisory board that represents, right, these small communities that are a little more challenging to serve for us? We want to review effectiveness. You know, what are our screening rates? How many children are we catching, so to speak? How many children are identified as being on schedule versus children who need extra practice with skills? Are we, how are the referrals going? Are they making it to ECCS or health clinics? What are our collaborations look like in terms of collaborating with our pediatricians and our clinics? And we want to ask many, many questions, and of course, there's far too many questions to cover here, but we would like you to refer to this implementation progress worksheet. Again, we cannot emphasize enough the rich content in the user's guide, and you have very specific page numbers to refer to, but we have many, many questions that you can use as an evaluation process. We also have, right, the PDFs that you can see up on the screen, which is in the ASQ resource library. So we have simplified versions of the user's guide, most pertinent information. We want to make very targeted program changes. One of the bits of advice that
was put out by probably many programs, but I know there was an Australian Aboriginal study that I was just reviewing for this webinar that reminded readers that what was so important is to have a centralized location to keep track of items of confusion, cultural barriers, translations, interpretations, the things that were running across in our communities, just keep running track of those and being able to have a way to go back and review those as we're reviewing our process and make changes as time permits and as we can literally make clear decisions based on our community's input. So being able to really track and account for, right, the thinking process and the change process over time is very critical. We want to, again, always be setting targets around hiring diverse staff, training targets. We want to refine our kind of child find efforts. We call that child find in the world of early childhood special education, which is really public awareness. You know, how are we putting this out into our communities that's in a manner that is accessible, that is graphically appealing, that is culturally relevant, that is positive and celebratory. And I think that the most important punch we want to make here as we end this slide show is if we can develop screening as a service that celebrates child development and celebrates the ability to applaud our children's milestones as they meet them, we will have a far more, I think, cooperative effort with the communities that we're working with, and slow it down.
Slow it down.
Yeah.
Yeah, that I think when we were also preparing for this, there was a question about this, you know, where programs or, you know, some of you may have this worry that, wow, you know, we don't have these follow-up services or some of the services, especially probably around infant mental health. You know, we don't have those specialists. But as Jane just said, to keep in mind that the vast majority of infant mental health work is around very simple early childhood work. It's around developing relationships with families and being able to respond to concerns and them just having a partner in this process. And so that screening in and of itself, again, done well and done with a lot of heart and with with a lot of trust, is a service for your community. And then we also have a number of activities, ideas, learning activities, these types of things. Again, there's a lot of very lovely versions of them at agesandsages.com, but they also may require a good amount of adaptation or thoughtful going through, depending on which cultures you're working with and how you may even introduce those kind of activities for families. Mm-hmm. So there are translations available. The current ones that are available through the publisher are Arabic for ASQ3, Arabic, French, Spanish, Vietnamese, coming very soon, Chinese, both simplified and traditional, through Patient Tools, who works with closely with the publisher, Hmong and Somalian. The ASQSE2 is available in Spanish, coming soon, French, and then also through Patient Tools, there's a Hmong and Somalian version. There are also a number of other translations / adaptations that you can contact Rights at Brookes Publishing there to find out more about them. And or, as Jane was saying earlier, if you are interested in pursuing that, like adapting the tool, there's a whole process laid out that's very careful, and you can get started with that through the publisher. These are some of the resources, just links for you, you know, guides for the how to adapt these tools, tips for screening children. Again, agesandsages.com. Take a look at what they have related to working with diverse cultures, adapting, translating, and for how to work within a community. And if you have specific questions for Jane or myself, this is our contact right here. And to learn more, Brookes Publishing is where you get more information about tools and resources that you can purchase. Agesandsages.com is actually just wonderful bunch of free and accessible materials that have been developed over time that you're welcome to download or view, webinars, different things at your leisure. So I think that's it for us, and hopefully we didn't go over too much.
Thank you, Jane and Liz, for that great presentation and some great information and resources. I just want to encourage everyone to, again, put your questions in the chat box. We did have a question regarding whether or not the tool was available in different languages, so you answered that question already. So we're going to turn it over to your colleagues from Utah who will provide some real-life examples on what they've done in their state and local communities. Utah team, we're turning it over to you.
All right, thanks, Debbie. This is Justin Nuckles. I just wanted to check in as far as time goes. When would you like us to kind of shoot to wrap up our portion so that we have enough time for the Q&A and everything?
So if you could aim for about 4:15 Eastern time.
Yeah, Debbie, I think that's right. I was going to say the same. Just keep to the same time, Justin, that you guys were planning. And we'll list any questions that we can't answer today, we'll follow up afterwards with folks.
All right. Well, my role in this is very brief. So I do work for the State Department of Health in Utah. My program is located within the Bureau of Child Development, and our program is called Early Childhood Utah. And as was previously mentioned, my role specifically kind of on our team is to kind of oversee this developmental screening initiative using the ASQ tools. So in the last, I've been doing this for about 3 years, and in that time we've been partnering with, not only, it started out kind of when I started, mostly and substantially with child care providers and things, but since being in this since being involved with this, we have expanded that to home visiting programs, school districts, public health departments. We even have a few pediatricians that have partnered directly with us. We have gone kind of a different route, I think, than a lot of states have taken, at least by my understanding, very limited understanding though it may be, in that we have opted at the state level at this point in time, and we're kind of in discussions whether or not this should change in the future as we kind of expand and anticipate this expanding into our state at large. Especially given the work that we've been doing for this grant and our 3 place-based communities and things. But we do have, as it stands right now, we have a single statewide ASQ online enterprise account that we have kind of chosen to pay for ourselves, just kind of absorb the cost there, and kind of set up our individual partners with program accounts underneath that single enterprise online account umbrella. So our 3 place-based communities that we have, and we have 2 of them represented today. We have represented from our Ogden Promise neighborhood that's here with us. That will be Rebecca when she kind of contributes her insight, and then from San Juan County, the whole county is our 3rd place-based community. I skipped over South Salt Lake. I apologize. But Darcie is our representative from San Juan, and I am just going to get out of the way and let them talk about their respective areas. When I was first kind of approached or asked about doing this and presenting some of this, they wanted to know what it was like working with some of the diverse populations in Utah, and I was their initial touch point, and I just said, well, if we want really valuable information, I'm going to have to recruit some people on the ground, the boots on the ground who are actually doing this work. So as I mentioned, I'm going to step out of the way and turn the mic figuratively over to Darcie and let her talk to us first about the work that's going on down in San Juan County.
Okay. Hey, everyone. Hi, my name is Darcie Chamberlin. I'm a nurse with Utah Navajo Health Systems, or UNHS, in the southeastern part of Utah, covering the Utah portion of the Navajo Reservation. We have 5 nurses working in the public health field in San Juan County. 3 of us work for UNHS and cover the Navajo Reservation, which is about 4,500 square miles. 2 nurses work for the county and cover the remaining 3,500 square miles in the county. So just to give you an idea of the ruralness of our county, the county population is about 14,000. So there are about 2 people per square mile in our county. As public health nurses through UNHS and the county, we provide home visits using the Family Spirit model. And I'll talk about that in just a moment. We are MCHB funded. We have specific challenges in our area, and we have had some successes, and I'm excited to share those with you. And then lastly, we'll talk about moving forward and some of the things that we'd like to see. So the Family Spirit model is a home visiting program developed by Johns Hopkins University. It was developed in partnership with American Indian communities to promote maternal and early child health. Family Spirit is relatively new, and it's only been in place in Utah for about a year, and we were the first in Utah to do it. I think there's another county in the middle of the state that's going to implement it soon, but we've been doing it for about a year. So next slide. When Johns Hopkins was creating this home visiting program, Family Spirit, they surveyed the target tribal population and charted some baseline results. And I included this slide because the key findings of the baseline data are some of the biggest challenges that we face in promoting early childhood health and wellness. The average age of our participants in our program is 18, who are 25 weeks pregnant. 77% are first-time mothers. 97% are unmarried and have very little support. Less than half remain in school. Over half are transient or don't have a stable home. They've moved more than a couple of times in the last year. And the biggest substance abuse issues that we deal with are alcohol, marijuana, and tobacco. These products, as you know, all affect in vitro development as well as cognitive development for young children in the home. So those are definitely some of our biggest challenges. Okay, go ahead. So in addition to those statistics, those baseline statistics, our participants have specific challenges. And this is just a little list of some of those challenges and the ways that we have found to be effective in facing those challenges. The Native American culture has historical trauma, and I'm glad that that was already addressed a little bit in the earlier slides. This historical trauma does carry into their daily lives today. And it goes back to historically going into the government-run boarding schools. Young children were sent there, and they were punished for speaking their native language. The Navajo language, or Diné Bazad, is not a written language. It's only become a written language in the last 10 or 15 years or so. So at the time, children did not know how to write. And punishments in the boarding schools came from people who knew how to read and write. So if you can visualize someone with a clipboard or a paper and pen making notes about things that they're doing wrong, also any government agency that would go into the home child protective services, the judicial system, things like that, are people who are well educated with clipboards, with papers and pens. So one of the challenges that this historical trauma creates for us today is trying not to come into homes with clipboards and paperwork for parents to fill out, or to fill out in front of the paper, or things like that. And across the board, when I spoke to my colleagues and people who try to get these developmental screenings done, one of the biggest challenges that we face is that parents don't want you to think that anything's wrong. And I'm sure that's universal in a lot of families, but we pick up a lot of completed ASQs with 100% perfect scores. And so that's one of our challenges is trying to minimize that historical trauma with the paper and the questionnaire and filling it out and all that kind of stuff on things that might be wrong. This challenge also goes hand in hand with cultural misunderstandings and illiteracy. Many of our participants are illiterate or don't have of high degrees of competency or comprehension with printed material. So some of the ways that we face that particular challenge with the illiteracy, the cultural misunderstandings, historical trauma is just with the mindfulness. We talked earlier on the slides about trauma-informed care. Using circular communication and visiting not being so direct, using indirect communication, nonverbal, it's slow-paced communication, things like that are a lot less threatening. Another challenge that we included was food insecurity, and I know it doesn't necessarily have to do with developmental screenings per se, but as many of you know, food security is defined by persistent, inconsistent sources of food, living more than 10 miles away from a grocery store, or living in a climate where growing one's own food is challenging and difficult. So this food insecurity creates a challenge for us with developmental screening, because if you can imagine, when a parent is asked to complete a questionnaire about her child's development, but she's unsure where her next meal is coming from, whether or not it's going to be enough food, whether there's going to be family visiting and she'll have to get more food, that questionnaire kind of is the last thing that she's worried about. So one thing that we have found as a solution to that is a fruits and vegetables prescription program. It's fairly new to our area. I don't know if many of you know about it. It's a program that provides vouchers to families for fresh fruits and vegetables every month. It's a really great program. All my participants want to take part in it, but you have to live on the reservation and buy your food at the reservation, so it does have its own challenges. Most of our families do live more than 10 miles away from any grocery store, and transportation is a challenge. The reservation is a very remote area with canyons and gulches, washes. Our participants struggle with reliable transportation, which affects their ability to get to the grocery store, as well as medical appointments, wellness appointments, WIC appointments, things like that. So some of the things that we've done to combat that, we've been able to provide transportation to appointments. Currently, our transportation within UNHS is limited to medical appointments, WIC appointments, things like that. It doesn't help with getting them to the grocery store, running errands. And I don't think our county provides transportation for participants, just the UNHS through our program here. Okay, next slide. Some of the successes that we have seen in our area: San Juan County has formed an Early Childhood Coalition, or ECC, with members from multiple state, county, and local agencies. And every month, this ECC creates a plan to promote developmental screenings by piggybacking onto community events that draw large crowds. We have teddy bear clinics, we have ladies' nights at the hospital or at the clinic that promote wellness and booths, health fairs, things like that. And the Early Childhood Coalition creates a plan every month to include promotion of developmental screening, education and awareness of developmental screening, and things like that at those places. And we've had some success there. Utah Navajo Health Systems has a plan to include developmental screening with every well child visit. This has not happened yet. The plan has to go through a process of being approved by the UNHS Board of Directors, who are all Native American, and the process is that it is introduced to the board, and then in subsequent meetings it's discussed, and then a plan is put in place. So hopefully we're looking at getting it into every well child exam probably by next year. Another thing is our county public health department. To combat some of those challenges, our success has come through a mobile WIC RV that travels to Monument Valley, Navajo Mountain, and Montezuma Creek, and that increases access to services in those remote communities. And they promote ASQ and developmental activities. They also have information and try to get some screenings done when they're there. Then our Family Spirit Home Visiting Program through UNHS and through the county, we strive to do regular screenings and then share the results with the local providers here. And UNHS also has a behavioral health division that has a vested interest in promoting ASQ screenings and providing education about developmental milestones. All right, so moving forward, we mentioned the plan to utilize the ASQs at every well child visit, and hopefully that will happen by next year. The current technology, meaning that the screenings could be done and results given just from doing it online. Some of the problems that we may have with that is that even with the online developmental screening, they are still word heavy, and we would, if we could possibly make a suggestion, it would be that there might be interactive surveys or maybe picture heavy heat map image selection questions or image selection questions so that parents can complete it without having to rely too much on comprehension of the sentence. One particular phrase I'm thinking of is whether a child can use her finger and her thumb to pick up a Cheerio, and then another question deals with picking up a Cheerio and is the forearm resting on the table. And so just little specific things like that are confusing to some of our participants, and so having a picture or having an interactive thing where they can, it just might be helpful in the future. But we look forward to increasing our developmental screening participation. I know we've had some challenges in the past, but we're having a lot of success with some of these things that we're doing. So thank you for listening.
This is Rebecca Virgo from the Ogden United Promise Neighborhood Prenatal to 3 Committee that is here in our place-based community. First, I want to thank the Brookes presenters today for presenting so thoroughly on so many of the guidelines and strategies that we are implementing with our families, flexible, really celebrating the early child and early childhood development and all of the things that our little ones can do. So I don't know if I have control of these or not. I do. So our first work, obviously, as place-based communities, was in creating a committee, really, to tackle our community and to drill down and see what we need. And Ogden is a place that has, it really has a long history of need and a long history of support systems and programs who are ready but not connecting. And this disconnect it's been very prevalent, and so knowing who to bring to the table and what everyone already knew about early childhood and the ASQ screening itself, or just developmental screening in general. The ASQ is definitely the one that we have been using and pressing for. It's actually the one that is in the Parents of Teachers program, which I am also the program administrator of. It's what we use, and so it was what I was the most familiar with, but it isn't what all of the programs in the communities were using. And we felt like it was really important to have early childhood as a topic of conversation. I mean, one of the things that we found is that that 0 to 3 piece seems to be something that everybody just takes for granted. Like the development is just going to happen, from doctors to teachers to parents to judges to it just seems to be that area has been really taken for granted. So I'm very excited to be doing this work with all of you. And but bringing partners to the table and finding out what they already knew and what they were already doing, and learning how to be flexible together has been a really key element to really our success, I think. One of the things that we are still challenged with is bringing moms from a very particular zip code. So our Promise neighborhood encompasses 84401 and 84403. And that 84401 family is just, it's tough to get to. One of the things that we have found is that we have to just toss out and let go of all of the biases and the marketing research and all of those things, those strategies that have really been prepared for and trained toward the consumer, like billboards or websites or social media or things like that. Our families do best when we are face-to-face with them, when there is some trust, when the clipboard isn't part of the equation, and where all of those things is absolutely true for Ogden. So Our successes, though, we have just completed our second developmental screening day. We called it Spring into School Readiness, and the picture you see here on the slide is actually the one that we used to advertise it, and we felt like it was perfect. We have families that are happy and engaging with their little ones, and that's really what this screening is about, is to engage the family, to let them know what's possible for their child at the age that they are, and to discover the things that they might be lacking in opportunity. Like, we've noticed parents don't give their children crayons, and they don't give them scissors, and they don't let them get dirty, and those are some of the things that are the most important for their childhood development. So talking about those things and really having that conversation in a celebratory way has been very impactful. It's had a really great, just really great success with our families. Some of the things that I wanted to bring up from that developmental screening day for diversity, I mean, we were had the opportunity to have families come. So what we did in that day was to bring the university students together with our nonprofit providers and invite the community there to get to know some of the resources and the supports that are in the community, but also to complete a screening for their child. So we had Spanish speakers and English speakers both, and we also had students who were ready to handle those that may not have fallen into a diversity category that we had thought of. For example, we had a family with a visually impaired mom and a hearing impaired father, and completing that screening for their two little children together was honestly, I think, one of the biggest triumphs of the day because none of us had really trained for that particular diversity, for that particular challenge. And yet with the training that we had done and our history of being flexible and really working with the families and taking them where they are and knowing that they're the expert on their child, where their child is right now, and having that approach to the family was so successful in that particular moment. So let's see. Things that other successes we're having, our teen fathers getting involved with mothers. In our home visiting program, we have parent educators who make sure that their schedules are very flexible so that they can be there with moms and dads and together. And hearing, you know, at the end of the ASQSE, when the parent is asked, what do you love about your child, we try to ask, what are 3 things that you love about your child, so they don't just give us the answer everything. And hearing a teen dad say about his 2-month-old, I love how he burps, I love how he passes gas, and how he scrunches his face before he poos. I mean, those are the things that you might not expect at all in your training, but those are the things that are delighting our parents, and it's important to get to know those things. So we just quickly, having successes in these areas, these things that are listed here, one of the things that we've invested in our state is called Bright by Text. The United Way of Northern Utah was able to secure a grant from the Daniels Fund, and it's a texting service that gives both developmental information that's already been planned by that app, and that there's also, or that texting service, and there's also the possibility of our giving specific messaging that goes towards a certain age and a certain zip code across the state. And so we're able to talk to our parents about developmental things, about programs and opportunities in the area, and about developmental screening, and to remind them of those things. That's actually what our messaging will be for Mother's Day this year, is to kind of check in and see how your child is doing and give her a pat on the back for being a great mom. We're also working with our Midtown Community Health Clinic. Rather than Disney movies, we are working on getting developmental videos in for that early childhood development, and having screens done in the waiting room while a child is waiting to see their provider, so that they can have that, the provider has instant access to that information and can really talk to the parents and celebrate when there's celebrating to be done, and direct them towards some opportunities where a child might be lacking when that's a piece as well. The other thing is community education breakfast is just really creating a space where we're learning together as a community. We found that our community is just engaging. They're willing to learn about this early childhood, even though it's been taken for granted in the past. that learning about it now, it just makes sense and it's clicking to see this longitudinal approach that begins at the very beginning in that prenatal way. So I see that I'm at 2:17, so I would like to leave some time for questions. But lots of great things going on and challenges that we're still facing. Like as I said, the one thing is still really drilling down and connecting with 84401 as a population. For the wonderful thing about being a program administrator and participating in this work as a committee level and our community level is that it's really informed what I do in my home visiting with my home visiting team. And so we have completely changed our recruitment style from waiting on referrals to come from the hospital or the clinics and things to getting face-to-face with our families. And so we have gone from only 3 families in the 84401 area to 30 families, and that makes me really happy. So just keep doing the work that you're doing. Remember, it takes some time and some creativity, and celebrate what you do. Thank you for your time.
Thank you, Rebecca, and the Utah team. I think we've had a wealth of information shared during this presentation. I do want to encourage everyone to continue to post your questions in the chat box, and also you can raise your hand if you have questions as well. We do have a couple of questions. So one is directed towards Darcie, and it's a question regarding the food and the fruits and vegetables prescription program. And the question is, are the foods that are included through the program aligned with the WIC or SNAP food list?
Oh, okay, hi. So the fruits and vegetable prescription program is separate from the WIC program. And it's been a long time since I've looked at WIC itself, but it's particularly for fruits and vegetables. It doesn't cover proteins or cheeses or beans or anything like that. But if you would like more information on that, because I work in the blending area, which is not situated on the reservation, I actually don't have personal experience with the fruits and vegetable prescription program. That's with my colleagues down on the res. But her name is Tiona Grant, and her email is TGRANT for Tiona Grant at UNHSINC, and that stands for Utah Navajo Health Systems Incorporated.org. And if you just
so Darcie, I was going to ask you if you could type that email into the chat. That would be great. I think that would be very helpful. Okay.
I'm actually typing it right in, Debbie, so don't worry about it, Darcie.
Okay.
I got it.
Okay, great. Thank you. Thank you.
Great. Thank you. Darcie, there was another question about the teddy bear clinics, and they wanted to know if how the screenings are integrated within those clinics.
Okay, yeah, so we're really proud of our teddy bear clinics. When Utah Navajo Health Systems first started, there was no rural community clinics in this area. We had a county clinic in Monticello, which is an hour or more drive from for a lot of our residents. And so in order to get participants or the patients in these communities to come to the clinic and be comfortable coming to the clinics, we have rural health centers now in Montezuma Creek, Navajo Mountain, Monument Valley, and Blanding, and each site hosts a teddy bear clinic once a year. We do about we go every Friday for about a month and a half, one at each site. And every department in the clinic, X-ray, there's usually a booth on hygiene, there's a booth on oral care, we get our dentists to come, the nurses will come and give out Band-Aids, talk about shots and immunizations. We have our behavioral health that talks about that. We have a booth for diabetes prevention, things like that. So we open the clinic. The clinic closes down for appointments during that afternoon, and the clinic orders, you know, hundreds of teddy bears, and it's for kids from 0 to 12. We'll come and get a teddy bear with a little adoption certificate, and then they'll walk through the clinic, through the exam rooms, through radiology, through, you know, all the different aspects of the clinic, and visit the booth. And we have our nurses and our providers there handing out little prizes and stickers and things like that go along with their department, and it's been really successful.
Great, thank you for sharing that. And I just had the question of whether or not you have been able to utilize the ASQ with maybe translating it into the Navajo language. I don't know if you administer it verbally. Have you all had to do that?
Yeah, that's a great question. The difficult thing about the Navajo language using an interpreter for the ASQ would be that a lot of the, the Navajo language is spoken by the elderly, and then for a long time it was not spoken. And so we have young kids, like elementary kids, who are learning it again in schools, but a lot of our moms and anywhere from, say, age 15 up to 40, 50 don't speak it fluently. And so if there's an elderly, if there's a grandma that's caring for the kid, that might be beneficial, but most of the moms speak English very, very well, and the Navajo's not as well understood anymore.
Okay. Thank you for sharing that. I did want to also point out that Fovia Khan, SQ, has put in the chat box that food insecurity is included in the 4th edition of the Bright Futures within the focus of social determinants of health, and is key to supporting children and families. So that's a resource that people can utilize as well. Please continue to put those comments and questions in the chat box. I don't know if we have anyone who's raised their hand with a question.
Debbie, I do see a question that came in from Kima Smith just now. And it says, hi, I have a quick question. I'm a home visitor, and I find that all the documentation we have to do each visit, we conduct a developmental screening for funding purposes, seems burdensome to our families. Any insight on how you guys suggest navigating this so that we can be more likely to provide our families with a good service?
So I'd love to take that. This is Rebecca from with the Parents and Teachers Experience. Part of the thing that we found is the way that we approach that paperwork with our families, and also the way that we've spread it out. So we are doing the Parents and Teachers model with MCHB funding, and we have a certain timeline that we bring in and separate out each of the types of paperwork. So the ASQ is done when we're talking about health and those child development things on the 3rd visit or so. And it's incorporated into the play, and so we sort of theme the visit around what the paperwork might be, and we've found that very beneficial. So with the Parents and Teachers models, there are 3 pillars. You have the parent-child interaction, you have developmental parenting, and you have family well-being. And if we theme that so that they tie in together, it just becomes part of the visit, and it becomes part of the conversation. So it's part of the, I think part of it is the way that you use the tool, that, as Darcie said, that clipboard question mark model is, it can feel burdensome. It becomes about the paper and about all of those things that you're doing. But if you're making it a conversation and it's part of what you are using to get to know the family and for them to get to know their child and to look at things a little bit differently than they have in the past, everybody handles it really well, and honestly starts to look forward to seeing what the next screen is and how they're doing with follow-up screening 6 months later and things.
Thank you, Rebecca, for sharing that. That's great information. Liz or Jane, do you have any words of wisdom to add there?
I think our response is really similar. It's just, figuring out a way to separate all that just, policy kind of paperwork from the screening. And when you get to the screening, to just be like, okay, this is really the heart of what we're talking about here. So kind of similar, if all that upfront things can be done and it's just really defined as a very different thing once you get to the screening. And then, that it becomes that conversation.
Thank you for sharing that. I don't see any other questions or hands raised. We did receive a question through CoLab for the ECCS CoIIN, and one of the impact grantees is curious to know if any other states are using the ASQ3 database to collect information for the annual indicators. So if anyone is doing that, if you could either chat that in the box or raise your hand, that would be great to share that information. Okay, well, we're wrapping, coming down to the last few minutes. Well, it looks
Debbie,
like,
I see one question, sorry to interrupt, that came to me as the host privately. And it's a question for Utah. Is there still Help Me Grow in Utah? If so, how are you working with them?
There is still Help Me Grow in Utah. Kaylee Iverson, do you have you're here. Help Me Grow is where we are funneling many of our ASQs to be able to be served. The capacity, we're trying to be really watchful and mindful of the capacity and things there. So they are here. We are working together.
Thank you. And Justin chatted in the box that Utah is using the ASQ database to collect the information for the annual indicators.
It looks like New Jersey just chatted that they'll be using it as well.
Okay, great.
And I see, Debbie, one person's hand up, but I know that we are on at time. I'm actually just going to encourage, I think it's Jamie who had their hand up, to just go ahead and chat that question into the box, and just to respect folks' time, we can take that question and follow up with the presenters if that's okay with you all.
All right, well, thank you, everyone. We really want to thank our colleagues from Utah for their presentation, and definitely our partners from Brookes Publishing. Jane and Liz, thank you so much for the great information that you shared, and we will continue our partnership with Brookes. We're hoping to have them hopefully on site for our face-to-face meeting in July. So thank you so much for all of that information, and we will make sure that we get the slides and everything. I know they will be posted on CoLab. Anything else, Amal?
I don't have anything else. Thank you so much, everyone, and just, encourage you to connect with each other as you start to roll out your different ASQ systems and learn from each other. But thanks for everyone for joining us today, and we'll talk to you all soon.
Thank you.
Thank you.
Bye.
Thank you. Bye.
My God.